Tolvaptan 30 mg tablet is a medication used to treat low levels of salt, sodium, in the blood, which can occur due to conditions like heart failure and certain hormone imbalances. It is classified as a vasopressin receptor antagonist and works by increasing the amount of urine you make, helping your body to get rid of extra water. This helps to slowly increase to normal levels of salt in the blood. It is important to note that different brands of this medication have different uses, so it is essential to follow the guidance of your doctor and not change brands without their direction. In terms of daily dosage, it is recommended to take Tolvaptan 30 mg tablet exactly as prescribed by your doctor. It is also important to take it at the same time each day to maintain consistent levels in your body. The best time to take this medication can vary depending on your individual needs and lifestyle, so be sure to discuss the optimal timing with your healthcare provider. Overall, Tolvaptan 30 mg tablet can be beneficial for those dealing with low levels of salt in the blood due to heart failure and hormone imbalances. Be sure to follow your doctor's instructions closely and not change brands without their guidance. Before you start taking Tolvaptan, make sure to read the medication guide given by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. It's important to not take this medication for longer than 30 days. To prevent dehydration, always keep water handy and drink when you are thirsty unless directed otherwise by your doctor. Take Tolvaptan at the same time each day to get the most benefit from it. Do not stop and restart this medication on your own, as you may need to go back to a hospital to restart it. If you stop taking this medication for any reason, tell your doctor right away. It's important to avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it is safe to do so. Grapefruit can increase the chance of side effects with this medicine. The dosage of Tolvaptan is based on your medical condition and response to treatment. Some common side effects of Tolvaptan 30 mg tablet antidiuretic hormone antagonists include thirst, dry mouth, loss of appetite, constipation, and weakness. If these effects persist or worsen, it's important to consult with your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. Dehydration is a possible risk, especially if you experience ongoing vomiting or diarrhea and are unable to drink normally. Seek medical attention immediately if you notice symptoms of dehydration, such as a rapid heartbeat or dizziness/lightheadedness. Individuals with severe liver disease, cirrhosis, may have an increased risk of bleeding from the stomach or intestines while taking this medication. Contact your doctor right away if you experience symptoms such as black/bloody stools or vomit that contains blood. In rare cases, Tolvaptan may cause serious liver disease. If you experience symptoms such as persistent nausea/vomiting, loss of appetite, stomach/abdominal pain, yellowing of the eyes/skin, or dark urine, seek immediate medical help. While a severe allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice symptoms such as a rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you experience any other effects not mentioned here, consult your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. When taking Tolvaptan 30 mg tablet, it's important to start or restart treatment in a hospital for proper monitoring. This is because if your level of sodium in the blood is raised too quickly, it can lead to a serious, even fatal, condition called osmotic demyelination syndrome. The risk of this is higher if you have liver disease, poor nutrition, or if you use/abuse alcohol. If you experience symptoms such as trouble speaking/swallowing, mental/mood changes, such as confusion, weakness/involuntary movement in the arms/legs, or seizures, it's crucial to inform your doctor right away. It's important to note that Tolvaptan 30 mg tablet should not be used to treat a certain kidney problem called autosomal dominant polycystic kidney disease, ADPKD. Due to the risk of serious liver damage, it's essential to be in a special program in order to take this medication to treat ADPKD. Be sure to ask your doctor for more details. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions. They will be able to provide you with the specific dosage that is right for you, as well as the best time to take the medication. Before taking Tolvaptan 30 mg tablet, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Before using this medication, be sure to share your medical history with your doctor or pharmacist, especially if you have diabetes, liver disease, or difficulty urinating. It's important to have this discussion to ensure the medication is safe for you to use. While taking this medication, it's important to stay hydrated by drinking fluids. If you have difficulty drinking normally or cannot feel when you are thirsty, be sure to inform your doctor before starting this medication. This medication may rarely cause an increase in blood sugar, which can worsen diabetes. If you have diabetes, it's important to monitor your blood sugar regularly and share the results with your doctor. Your doctor may need to make adjustments to your diabetes medication, exercise program, or diet. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used if clearly needed. It's important to discuss the potential risks and benefits with your doctor before starting this medication. It is not known if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding while using this medication. When taking Tolvaptan 30 mg tablet antidiuretic hormone antagonists, it's important to be aware of potential drug interactions. This medication may interact with other drugs, which can change how they work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Tolvaptan is vasopressin. Additionally, other medications can affect the removal of Tolvaptan from your body, which may impact how Tolvaptan works. Examples of these medications include azole antifungals, such as ketoconazole, itraconazole, cobicistat, HIV protease inhibitors, such as lopinavir, macrolide antibiotics, such as clarithromycin, erythromycin, ribociclib, rifamycins, such as rifabutin, rifampin, ritonavir, St. John's wort, and drugs used to treat seizures, such as carbamazepine, phenytoin, among others. It's important to discuss any potential interactions with your doctor before taking Tolvaptan. Always follow your doctor's instructions and guidelines when taking this medication. If someone takes too much Tolvaptan 30 mg tablet and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, and Canada residents can contact a provincial poison control center. It is important not to share this medication with others. Your doctor may also require you to undergo lab and/or medical tests, such as monitoring your sodium/potassium levels in the blood, while you are taking this medication. It is important to keep all medical and lab appointments as scheduled. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one as scheduled. Don't take a double dose to make up for the missed one. When it comes to storing Tolvaptan 30 mg tablet antidiuretic hormone antagonists, it's important to keep them at room temperature and away from light and moisture. Make sure not to store them in the bathroom and always keep them out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure of the proper way to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.